Morning, Dr. Patino here at the Cosmetic Surgical Center Cerrito. We're doing smart laser assisted lipolysis to the neck, and then we're gonna do micro assisted liposuction to the neck. So this technology, the laser has an affinity for the hemoglobin, which is the part of your blood that carries oxygen to the tissues, right? And so it gives you vasoconstriction because it makes your blood vessels smaller. So as a result, then you have less bleeding, right? In addition to that, we're using lidocaine with epinephrine. The epinephrine clamps down the blood vessels so that there is also less bleeding. So less bleeding, less bruising, right? The laser, what does the laser mean? Laser, the L is light, A is amplification, S is stimulated, right? E is emission, and R is radiation. So light, amplification, emission, radiation, right? Stimulated emission, radiation, right? Laser, that's what it means, right? And so how can we make this simple for you guys, okay? And you're following the temperature, right? Okay, so the temperature is 40, so we're gonna go ahead, and that's the maximum temperature, so we're cooling the area. Yeah, very good. So the nice thing is that in order to avoid a burn, we use constant monitoring of the temperature, right? And so when it goes up to 40 is the goal. We want it to get to 40, but we don't want it to go above 40. Thank you. Are you okay? Okay, so we're using the laser, to decrease bruising, bleeding, and a faster recovery, right? And Wendy is monitoring the patient. We're also checking the blood pressure and the pulse and oxygen and everything. But on top of it, we're checking the temperature here, make sure we don't burn the patient. But we want to achieve maximum temperature, closer to 40. We're at 38 now. Why? To exert the maximum benefit.
40.
Oh, so that we're at 40. Just check it again. Make sure we don't go over 40, right? Because if we go over 40, then we can burn the patient, right? But the temperature, usually we cool it down, or like we did before, or we just let it rest like that, and it's good, right? And so the laser gives you maximum skin retraction, and the patient is very comfortable. She's awake. ¿Cómo estás? She feels good, okay? And yeah, very good. And we're protecting her eyes from the laser, and then we're gonna go ahead and do liposuction. Thank you. The beauty of doing this procedure under local anesthetic is that the patient, can bend her arm. We don't have to hold her arm, so it's very comfortable. And so we're checking the temperature, right? And we're doing the procedure. ¿Cómo te sientes? How do you feel? I feel very good. I'm only sleepy, that's it. Because we gave her some medication by mouth so that, she goes to sleep, right? But she feels sleepy, and, when we tell the patient, you feel sleepy, just go to sleep, right? We're monitoring her vital signs, her respiration, her pulse, her blood pressure. We're, monitoring this every 5 minutes. We have a registered nurse here, Wendy, and she's taking care of that. Her blood pressure is a little high because she has a history of high blood pressure, but that's about it. And we're monitoring to make sure that she's totally, with the program, that she is following commands, and so she is lifting the arm on her own. Y no sientes calor ni nada. No, you don't feel the laser here. No siente nada.
I don't feel it.
She doesn't feel anything. That's incredible. Thank you. Okay. So we're basically doing the same thing here, right? And the patient is just awake and she's following commands, right? ¿Cómo te sientes?
It's okay, just sleepy, that's all.
It's sleepy, so she feels sleepy, that's all. That's how you want the patient to feel sleepy. But do you have any pain? ¿Tienes algún dolor?
Not at this time.
No pain at all, not at this time. Okay, perfect. If she don't have pain now, she's not gonna have pain later. That's incredible, thank you. Also, what this is doing is melting the fat, so it's easier to take it out. But see, this kills the fat, so we don't usually use laser, or we never use laser, we should say, when we are doing a fat transfer, right? Because it would be silly, right? You would be killing the fat cells. But we can use it afterwards. So we can collect the fat first and then use the laser, right? But not like we're doing now. We're doing the laser now, then we're gonna suck it out because she's not gonna have a fat transfer. So thank you. Alrighty, so now we're doing liposuction, micro power assisted liposuction to the arms, right? ¿Y cómo te sientes?
I feel good.
You feel good, huh?
Yeah.
So we did the laser, now we're doing the micro air power assisted liposuction, and absolutely no pain, very comfortable, very awake, the patient. We gave her minimal sedation by mouth, so, she is, sedated, but she can answer questions. We basically talking to her throughout the whole procedure, and she's doing very well. So this is a very nice way. She can also hold on to her own arm. We're assisting her a little bit, but she's been doing this on her own arm. We're assisting her arm so she doesn't get tired, but she can do it her own. So that's easier than doing it under general anesthetic, where we have to basically be holding her arm when we do this procedure. So the advantages of doing it under local, of course, much less risk, complications, much less risk of nausea, vomiting, and the risk of general anesthetic, right? The risk of doing it under general, a little bit more, but more nausea, more vomiting, because they give narcotics and stuff. But we found an ideal way to do this, which is a combination under general and under tumescent. This particular patient is not having general anesthetic, but she's been monitored very closely every 5 minutes. We're checking everything: temperature, blood pressure, pulse, respirations, and make sure that she's okay. Blood pressure is a little high. We have to give her. You know what I love about this is that she's on the side now, lateral position or lateral decubitus position, and I'm doing the liposuction. But notice how comfortable I am. Notice how my strokes are very nice and well controlled, right? And notice how the patient is maintaining her own position, right? Because she is under local anesthetic. And look at the output. Look at this. This is beautiful. So no bleeding at all here at the Cosmetic Surgical Center of Costa Rica. It's just incredible. Let me ask the patient, how are you feeling? ¿Cómo te sientes?
Just a little sleepy, that's all.
A little what?
A little sleepy.
A little sleepy, that's all. She feels a little sleepy, that's all. Siente un poquito de sueño, eso es todo, ¿verdad?
Sí, es correcto.
Es increíble. Un poquito de sueño, that's not bad. To have a little bit of sleepiness, right? But this is incredible here at the Cosmetic Surgical Center of Costa Rica. It's just incredible surgery, very comfortable for the patient, very comfortable for the surgeon as well, right? And this is completely under local anesthetic. She's a little sleepy because I give her medication by mouth, but what we call this is minimal oral sedation, right? Because she can respond to commands, she can ask for help if she wants to, she can tell me if she has any pain, any discomfort, which is usually good because it can also guide the surgeon, right? The patient is totally asleep. You don't know if the patient, if you're going to an area that's not very well anesthetized, right? But here, if she feels a little discomfort, which she hasn't, then we can give her more numbing medicine, right? And that also will give her less risk of bruising, bleeding, etc. Thank you.